As always, we want to help keep you informed on ways to keep you and your family safe and healthy, especially as winter is coming. And here, once again, to help get the message out, Dr. Syed Hussain from Trinity Health of New England. And thankfully, it's been a while since we've really had to start drilling down with COVID. But we're still worried that maybe it's going to be seasonal, maybe cases are going to start rising again, and just like we can do with the flu, we can look to elsewhere in the world for clues. And what are we seeing out of the United Kingdom, Doctor?
Yeah, so the UK has had a sustained decrease in cases over the last 2 months, Tim. But over the last week, the 7-day average has jumped 13% in terms of positive cases that were reported by the National Health Service.
That's a big jump for 7 days.
It is. And with a 17% increase, more worrisome is the 17% increase in hospitalizations.
Yeah.
Now, this is just week over week, couple weeks, so it's still early to say whether this is a blip. Is it because of the large crowds that gathered due to the Queen's funeral, or is this really the start, the herald of a new wave, which modeling does predict will happen sometime late fall, early winter in the UK?
Yeah.
And whatever happens in the UK, as you know, based on what we've seen during the course of this pandemic, is reflected here in 4 to 6 weeks.
Yeah, and I think probably a lot of people out there would say, okay, maybe we're going to expect a rise in cases once winter comes, should COVID continue to be seasonal like the flu is. But there's more factors behind this, including slow vaccine uptake.
There is, yes, absolutely. Remember, we're dealing with very contagious variants. As the weather starts cooling down, people will start moving indoors, which means higher risk of getting COVID-19. Waning immunity, if you look at the data, this is prior to the new bivalent vaccine being approved.
Yeah.
There's only 35% uptake in terms of people who signed up to get the COVID-19 booster. That's very low. That worries me, because we need to do our part in terms of educating folks. This is a really effective and safe tool. Please get the new bivalent COVID-19 vaccine along with your flu shot now.
And this is going to be, I think, the third straight week I'm going to ask this question. Can you get them both at the same time? There's a reason why we keep asking.
Absolutely. Yes, you can. And it's become so easy now. You can go to your local pharmacy, get both the COVID-19 vaccine and flu shot scheduled on the same day, get it on separate arms, but you can get it on the same day, same time.
Are there any people for whom the flu shot is not indicated or just not a good idea right now?
Sure. So there are two categories, two buckets. First is any child under the age of 6 months. They're not eligible for the flu shot. And those that have had either a very severe allergic reaction to any ingredients in the flu vaccine or to the flu vaccine itself in the past, they need to have a discussion with their healthcare provider.
Okay. Other general tips. What should we be doing for general hygiene now? It's fair season, a lot of people out and about. We need to be washing hands, but what else should we be doing? Should we go back to mask wearing?
It's the same common sense measures that have helped us throughout the course of this pandemic, Tim. We're now moving to a stage where the onus of responsibility is on the individual, not state or federal mandates to mask, to distance. So using those same techniques will ensure that your loved ones and yourself are safe, especially if you have people that have underlying medical conditions, higher risk for developing COVID-19 disease. Use a mask. Avoid crowded indoor settings in the winter time. Make sure that spaces are well ventilated. So those things will be helpful. In addition, I'm going to go back to the vaccine to say how important the vaccination is.
The vaccine is too. And I should say, well, yes, you're right. These are now individual risk decisions. You still want to be community minded. And if you're feeling a little run down, a little sniffly, sneezy, you put on the mask just so other people aren't getting whatever germs you're spreading. It's commonplace in many other parts of the world. There's no reason why we can't do it here as well. So,
that's right.
Doctor, thank you so much. How about a fist bump?
Sure, thank you.
Just in case, because I might be one of those people in the next 24 hours starting to feel a little tickle there, Matt Scott.
Oh, good. Said the guy who sits next to me in the newsroom.
Yeah.
Fantastic.